What was penicillin's impact on sickle cell patient survival? Imagine a time when children with sickle cell disease faced a high risk of deadly infections just because of their condition. Before the introduction of penicillin, bacterial infections like pneumonia and meningitis could quickly become life-threatening. In fact, early childhood death rates from infections in children with sickle cell disease were alarmingly high, with about 30% of young children dying from these infections. When penicillin was discovered and started being used as a preventive treatment, it changed everything. Giving children daily doses of penicillin from a very young age significantly lowered their chances of getting severe bacterial infections. This was especially important for infections caused by bacteria like Streptococcus pneumoniae, which used to cause many deaths in children with sickle cell disease. Thanks to penicillin, combined with newborn screening programs and vaccines, the number of children with sickle cell disease who survive into adulthood has increased dramatically. In high-resource settings, over 95% of children with sickle cell disease now reach adulthood, a huge improvement from the past when many did not survive early childhood. The use of penicillin has also led to a big drop in invasive pneumococcal disease, which used to cause about 6 episodes per 100 children under 3 years old each year. Many of these cases were fatal. Now, with penicillin and vaccination, the risk of these severe infections has been greatly reduced, making a real difference in survival chances. Guidelines recommend giving oral penicillin twice a day from birth until at least 5 years old for children with the most common form of sickle cell disease. This is because early childhood is when the risk of infection is highest. Continuing beyond age 5 is debated, but most experts agree that early prevention is key. Even with these advances, infections still cause some illness and death among people with sickle cell disease. About 14 to 18% of deaths in recent studies are linked to infections. One challenge now is antibiotic resistance, where bacteria become less responsive to penicillin, which could make infections harder to treat in the future. While penicillin has greatly improved survival in children, adults with sickle cell disease still face increased infection risks. Their overall life expectancy remains lower than the general population, partly because of ongoing infection risks and other health problems. In everyday life, taking penicillin as prescribed, staying up to date with vaccines, and seeking prompt treatment for fevers are essential parts of managing sickle cell disease. These measures have transformed the outlook for many patients, turning a once deadly disease into a manageable condition with a much better chance of living a full life. In summary, penicillin has been a cornerstone in saving lives by preventing deadly bacterial infections in children with sickle cell disease. This has led to a significant rise in survival rates and improved quality of life. However, ongoing challenges like antibiotic resistance and infection risks in adults reminded us that continuous medical care and vigilance are vital for those living with sickle cell disease. Always consult healthcare professionals for personalized advice and treatment options.